Becky, and today I would like to discuss with you shin splints. So shin splints occur when you get some micro tearing in your shin muscle. This happens because of overuse. So normally it'll happen in the summer months because we might have been a little bit more sedentary during the winter months, not able to get outside due to the weather conditions. And then spring, summer comes and we get moving a little bit more. So we might walk more in our neighborhoods, we might be walking up and down hills, and that causes that overuse in your shin muscle from pulling that toe up as we heel strike when we're walking. So it normally takes about 3 to 4 weeks to recover. You can use the rice method at home. You can rest. You can ice it. Icing would be about 15 minutes. And then you can use compression. Compression socks are great, or even with the athletic compression pants that you can wear. And then also elevation. And again, elevation, we should elevate above the heart. So if it's our shin, we want to make sure that we're laying on our back and we have those legs up above the heart while we're lying down. And again, that would be about 15 minutes. So a couple things that you can do. You can also use some anti-inflammatory pain relievers, over-the-counter medications. And then stretching is extremely important. So in that shin bone, we want, or in that shin muscle, right along that bone, we would want to pull that toe against a step. So we could just step up onto our step, our first one, and pull that toe in. Stretching needs to be done for a good 30 seconds to a minute. So from the side view of that, so you can see, you just pull the toe in and you hold and maintain that stretch. Another exercise that would be extremely good is I have my little towel here, and you take your toes and you scrunch up that towel. I'm not going to be able to make it move too much here, but you scrunch up those toes to help counteract that force of lifting up. We want to scrunch the toes. 30 repetitions would be very beneficial. In addition to, they say that walking in grass or jogging in grass in bare feet. Not my favorite, but you can also get those shoes that have the toes so that you get a little bit more grip, and that also assists with that. Also, calf raises are really good. So just standing on the edge of a step, coming up into it, because we are working the counteracting muscle. So we have the toe pulled up. So the counteracting muscle for that shin is that calf muscle. One last treatment that you can do at home would be a massage, where you can cross your foot over your opposite leg. You'll feel the shin bone in there, and you can go right along that shin bone, right behind it, and massage. All up and down. A lot of times you'll feel a sore spot, or you might even find a trigger point. So that little hard, tightened part of the muscle that shouldn't be in there. If you find that, you can do that self-massage. You can add that pressure, hold, moving it just gently side to side until you can get a release in that. A lot of times it'll take 20 seconds or so, sometimes even longer, to get rid of that. Hopefully this gives some information on how to prevent or correct shin splints for you.